Today, healthcare is one of the biggest issues in the country and in the community, and I really believe that our system is doing a lot to help the health of every individual. Ultimately, will help Rochester overall.
I think patients benefit from the way the care is provided is that they feel that they're being treated as an individual and that it's not a mass production. Every person counts as an individual.
Well, I truly believe that we do the excellence every day.
I've seen the customer service increase tremendously. The understanding that employees are the best advocates for customer satisfaction.
You know, better employees translate to better patient care. When employees are happy, it shows in their work, the pride that they do, and that just transcends right down to patient care.
It is all about the patients here, and that it goes along with our level of commitment because we're committed to the patients. And some places like to say that beneath it all is the patient, but I think here the patient is at the top of the pyramid, and we're all below that, and we're supporting the patient, so that includes everybody on the team.
We've had experiences in other hospitals with other family members, and NEWARK-WAYNE is just, the care is, it's both things. It's the caring and the knowledge that really make a difference. So.
It's hard to explain it. I figured if I was in the same shoes, I would know the kind of care that I would expect, and that's a care that I see here, that all the staff and the doctors and nurses, everybody seems to deliver the same kind of care.
The nurses that I work with are compassionate towards the patients and their family. It's not just the patient, it's the whole family that is taken care of at NEWARK-WAYNE.
The whole staff in there was just wonderful for me and for the family. As far as encouraging, and their professionalism was just unreal.
Whenever you take care of a patient, it's not only the patient that you're caring for. There's usually a significant other who's going through a very stressful time in their life, who comes in and they see this person in the bed that might not look familiar to them. They have tubes and drains and IVs, and they're swollen, and you need to provide as much sympathy to the family as you do to the patient. I always tell the family that they'll never forget this time, but the patient probably won't remember much of it.
I couldn't ask for better quality care anywhere.
At the end of the day, it's just a good feeling that you've helped. Maybe if you've only helped bring a smile to one person's face, it's all worth it.
I used to work in another healthcare system, and it really was about the numbers and getting people in, getting people out. And, you know, and so what can happen is they just become another body in a chair, and when they're not there, another body in the chair. And this is so much more about, we really care about the people that are walking in the door.
It's very hard to get specialty care out in rural type of areas, which is why I really chose to come here. The impact sometimes is lost in the big city, and there is a huge need for specialty care out in the rural areas, which is what I've tried to focus the rest of my career on.
There are very few facilities that accept ventilators. And so I said, all right, I'll go. I said, I don't want to be here. They asked me, I told them I don't want to be here. But they won me over. My therapist is great. He takes me out and does things all of them do. I don't think you could ask for a better place to live.
I'll be honest with you, I had my mom come here to rehab when she was in the hospital, and she had always said, don't ever stick me in a nursing home. And when she came here, she was very happy with the care and would come back if she needed to.
It all revolves around quality, you know, quality of care, quality of people you hire, the systems you have, the technologies you have. By doing that, you are the healthcare system of choice, not only choice of patients, but of the employees, the nurses, the docs, and the rest of the staff.